I started getting migraines at the age of 7, 8. There were days I would make it through the workday, go home, get sick, have to go straight to bed, and then get up and go to work the next day. I just thought that's how everybody lived because that is kind of how I had always lived. It got to the point that I thought I had a brain tumor because I could not function anymore. I found out I had chronic intractable migraines, Chiari, and occipital neuralgia. I was in and out of the hospital, I think about 75 times. If it was out there to try it, I tried it.
Refractory migraines are extremely common. It's estimated that between 2 and 12 million people in the United States suffer from this condition. These patients are experiencing severe headaches most days of the month, and then those headaches are not well addressed either by the preventative medications or breakthrough medications. That's incredibly disruptive to your life and everything in your life, all your personal relationships, your ability to maintain employment. It's even more frustrating because you have this problem that's disabling you, but there's nothing on any kind of pictures or imaging that would tell anybody what that problem is.
So I was Googling in the middle of the night, trying to find any other alternative to help with my migraines. I came across the HealthCast with Haley and Dr. Fiorella, and I was like, oh my gosh, there's someone doing research. I was so excited when they said, oh, you're just the kind of patient we can help. They allowed me to do, most of the groundwork here in Chicago. And then I was able to just fly out to Long Island for the procedure.
We get them very comfortable, and then we numb up an area over that wrist artery and get that area completely numbed up. And then we put a small IV tube into the wrist artery under ultrasound guidance. Then we just guide our catheters up into the blood vessels that course into the head and neck area. We'll guide a small catheter into those arteries that supply the coverings of the brain, the dura, and then we infuse the lidocaine directly into those arteries. And so when you infuse the medication intraarterially rather than intravenously, it's got about 1,000 times more local concentration. As we're doing the infusion, we'll discuss with the patient, how are you feeling? How is your headache? Now we know that if we can get their headaches to completely break, to get them headache-free on the table, which we're able to do in 2/3 or more of the cases, there's an 85% chance or so, based on our current experience, that they'll experience relief that lasts for up to a month or more. The whole procedure typically takes only about 25 minutes from start to finish, and typically involves minimal to no discomfort for the patients.
In the operating room, I said, no, I still had a little bit of pain. And then they took me to the recovery room. They sat me up in the chair, and I looked at the nurse, and I said, I almost don't want to say this. I don't have a migraine. To have a migraine every day and then to have 2 or 3 a month, to me, is life-changing. To be able to go out and do things, and, it was amazing. I was extremely lucky because I had relief for almost 4 months. Being a migraine patient and encountering so many people in the medical profession that did not treat me respectfully, to come to Stony Brook and get treated like I mattered and that they wanted to help me was so heartwarming. Dr. Fiorella, thank you so much for changing my life.